Much for that wonderful introduction, and thank you very much for including me personally, including CDC, in what I consider really a historic event for Atlanta and for public health in Georgia and even beyond. It's a pleasure to be here. It's not surprising that we are having this meeting here in Georgia. Georgia is home to a wealth of world-class public and private institutions which touch every part of the health continuum, from public health to healthcare delivery, to the development of new technologies and treatments to keep people safe and healthier. Each organization brings a unique perspective, and when we work together, we can tackle the world's toughest health problems. As is not surprising to you, I'm sure, our world is becoming more interconnected every day, and this integration drives which health threats arise, how we respond, and how we should respond to those health threats. Throughout this event, as you make connections with the many organizations that are represented here, I'd like you to keep three things in mind. First, protecting health globally is increasingly critical to protecting health in the US and the global economy as well. Two, public health and healthcare must work together to improve health outcomes and reduce costs. And then three, we, whether we are public, private, or academic organizations, can accomplish more together than we can separately. Although effective solutions do rely on the collaboration of multiple players, I'd like to talk briefly about CDC's role and contribution to this interplay in protecting health. CDC works 24/7 to detect, to stop, and to prevent health threats in the United States and around the globe. CDC's mission is to maximize health and save as many lives as possible. And it serves as America's lead agency to protect the public from health threats. CDC essentially is the organization within our government that has boots on the ground in every state and in 50 countries around the world, where we find, fight, and stop outbreaks. Our obsessive focus is to better prevent the leading causes of illness, injury, disability, and death. And we're committed to doing this by improving health security at home and around the world, and by strengthening public health and healthcare collaboration. In today's increasingly interconnected world, we remain incredibly vulnerable. A disease anywhere can mean a public health threat everywhere. Globalization of travel and trade increase the chance and the speed of risk spreading. For example, in late 2013, chikungunya, which is a mosquito-transmitted virus causing fever and severe joint pain, was found for the first time in the Americas on islands in the Caribbean. And there's a risk that the virus will be imported to new areas by infected travelers. And in fact, we've had reported and confirmed cases of chikungunya in Florida for individuals who had no history of travel, meaning that it is spreading in the United States. This is a development that we had been watching for the last 10 years, and we had been seeing chikungunya spread across the world, fearing that it would reach our shores in the same way that dengue has, knowing that there was a possibility of intervening and preventing either the spread or the speed of that spread, and making sure that we maintain the level of security and health that we aspire to. In recent weeks, ongoing cases of Ebola in West Africa have reminded us of the devastating toll that infectious disease outbreaks have on health and stability of communities. Now, chikungunya is not a deadly disease, but it is a costly disease. Individuals are laid up with pain up to 2 or 3 months at a time, and that incurs significant expense. In Ebola, the expense goes beyond that, and we're talking about lives. Now, fortunately, it is not a problem here in the United States, and it's unlikely that it will be a problem here given the infrastructure that we have available to us to fight Ebola. However, the devastation that has taken place to date and the devastation that we anticipate is going to continue to play out in the coming months affect not only the countries in Africa that are suffering this devastation, but it affects all of us, because eventually the consequences to those countries very quickly become consequences for us. Therefore, it's not surprising, as most of you have heard, that the President is going to be visiting us tomorrow in order to get a personal briefing on what it is that we're doing, what it is that can be done, and what's needed in order to make that difference. Disease experts agree on the need for a stronger, unified ability worldwide to prevent, to detect, and to respond to disease outbreaks. While our world is more tightly connected than ever before, dangerous gaps remain in our ability to quickly detect and respond to disease threats. Ebola is the most tangible and tragic example so far for why we as a global community must work together to make the world safer from infectious disease outbreaks. To address these challenges, CDC is joining with other U.S. government agencies and global partners to advance a global health security agenda. The Global Health Security Agenda is a way for international organizations and for other countries to work together to propel and accelerate measurable progress across multiple sectors towards a global community that is safe and secure from these types of events. In essence, it's a way to fill in the gaps so that every country can detect, can respond, and prevent effectively for the benefit of all countries. In addition to improving the health worldwide and protecting U.S. health security, investing in global health can save money and contribute to a healthy U.S. global economy. For example, we know that the eradication of polio could save up to $50 billion by 2035, and extending the life of insecticide-treated bed nets in the fight against malaria could save up to $8 billion over 10 years. At CDC, we believe that prevention is king. The United States spends about $3 trillion annually on healthcare, which is roughly $9,000 per person. This accounts for 1/6 of our GDP. We must get more value for our health dollars. Domestically, public health and the healthcare sector can work together to improve health outcomes and reduce these costs. We can do this by changing our defaults and our systems to prevent diseases and not just treat them when they arise. Many healthcare costs and health-related productivity losses are preventable, and therefore we can do this. Conditions like hypertension, healthcare-associated infections, diabetes, and asthma can be prevented through clinical and community preventive services both, therefore increasing the quality of life and reducing healthcare costs. We can work together to increase clinical and community prevention in many ways, including improving accountability and quality through performance measurement, adapting, and scaling up reimbursement and financing models for preventive services based on successful pilot tests, and increasing clinician understanding of public health problems and national initiatives offering potential solutions. By reducing the burden of chronic health conditions and ensuring a healthier workforce, prevention lowers healthcare costs and health-related productivity losses, benefiting businesses and the economy as a whole. Because health is complex, no single agency or organization can do it all. Collective and coordinated multi-sectoral approaches are the most effective. In fact, sometimes we believe the only way of addressing the problems that we're facing. The importance and the role of public-private partnerships in achieving significant, sustainable improvements in health can't be overstated. Partnerships can extend each of our capabilities and allow us to leverage each other's expertise. And the private sector benefits from investments in health and well-being. Healthy employees and communities create healthy businesses and healthy economies. The problem is big. The solution is a heavy lift. But the payoff is also big, and the time to act is now. Government can't do it alone, academia can't do it alone, and industry can't do it alone. And this is why we're here today. So I would like to thank you for participating in this event and bringing your expertise and energy to bear on these difficult and critical issues, and perhaps more importantly of all, thanking you for today spearheading the collective action for saving lives and protecting people that the U.S. and the world depends upon. So thank you very much, and looking forward to the outcomes of the meeting.